So welcome everyone to this town hall organized by the Earth Institute at Columbia University and the National Center for Disaster Preparedness. And we are hoping to address a full range of issues that have surrounded the proposed reopening of New York City schools, something that obviously needs to happen. And the question is, when is it going to happen, and what are the issues that parents and others need to understand about reopening? And to kick us off, I have the great pleasure of introducing a friend, a colleague that I've known for many years, who had been in New York City as a major part of the New York City Department of Health for quite a long time. He escaped to other parts and has returned at the specific request. I wasn't going to say demand, but the mayor was really interested in bringing Jay back into city government, and for good reason. Dr. Jay Varma is a senior advisor for public health to the mayor and the office of the mayor in New York City. He's an infectious disease expert, and he brings a huge amount of expertise and experience to everything to do with the public health of New Yorkers, and he's played a very significant central role in how the city is going about reopening the schools. And so I'm just going to invite Jay to make some remarks. He's making these remarks on behalf of himself, but really on behalf of the mayor's office and Mayor Bill de Blasio personally. So Jay, if I can just ask you to jump in, and we're happy to have you.
Great, thank you very much, Erwin, and for everybody who's participating today, both on the panel and in the audience. I want to tell a little bit about my own sort of personal story of how I ended up here, and also how it's weighed in on how we're approaching school reopening here in New York. You know, in March, when parents, teachers, and students were coping with the fear and confusion about this new disease and what it meant for the schools here in New York City, I was actually far away from here. At the time, I was in Addis Ababa, Ethiopia, working at the African Union, training doctors and health officials from all over Africa for how to respond to the COVID epidemic. That was a role I had actually been in since 2017. You know, the principal of my daughter's school in Ethiopia actually asked me directly, you know, should we keep our school open? This was now in early March. And at that time, I actually advised them to consider closing fairly soon. While there were no officially reported cases yet in Ethiopia, this was an international school that had kids and parents from many countries that were already experiencing very severe COVID outbreaks. And Ethiopia just simply didn't have the health system to know for sure how many people had this disease. And, you know, and sure enough, 2 days later, after the principal at my recommendation made the decision to close the school, just 2 days later, the first cases were confirmed in Ethiopia. And one of those cases was in fact a parent who had been at the school that week. There was fear gripping the campus, much as it was, you know, in New York City. And within a week, my wife and daughter had actually evacuated back to New York City to join our other two kids whose schools had closed in the United States. So health and safety really must be at the center of our schools. And I relay that story because that's something that I know both as a doctor and I know this as a parent. And it really does sort of infuse and inform every decision we're trying to make here in New York City. You know, since March, we've learned a lot about how to safely reopen schools from the experience around the world. The single most important priority is to control the epidemic in your community. If you cannot control the epidemic in your community, you won't be able to control it in your schools. And we've seen this all over the world and all over the United States. So there are a few critical indicators that we in public health analyze to answer that question. You know, do we have the epidemic under control in our community? The first is, you know, how many cases are occurring daily in your city relative to your population? The second is, what percentage of people getting tested have a positive test? We call that the test positivity number. And third, what is the reproductive rate in your community? Something we call the R, which basically indicates, is the outbreak growing? Is it shrinking? Or is it staying stable? Here in New York City, we have the single best indicators for epidemic control of any major city in the United States. Our 7-day average of new cases is currently 1.5 per 100,000. Our test positivity rate is less than 1%. And our reproductive number, the number that indicates whether your epidemic is growing, shrinking, or staying stable, has been below 1, indicating a shrinking epidemic for over 2 months. So once you've controlled the epidemic in your community, how do you go about opening your school safely? And again, what we've learned from everywhere else in the world is that you need a combination of safety measures. And I want to pause for a moment and just focus on 2 really difficult truths that we need to accept before we think about the safety measures. And these are hard, so I'm going to be very blunt about them. First, no single safety measure is perfect. You need to layer multiple safety measures together. And then when they're used in combination, these measures can reduce the risk of any disease being transmitted in a school very dramatically. But it's really a combination, not any one individual method. The second, and this is really the most difficult truth, is that this virus may never go away. We certainly hope that we'll get a vaccine that will essentially eliminate it the way we have with smallpox. But the odds are that this is going to end up being much more similar to, say, influenza or measles, a virus that we have to live with and manage. So we may never be able to have a world in which there is 0 exposure and 0 risk from COVID. But what we can do, and we must do, is try to reduce exposure and reduce risk as much as we can. We need to protect our children, our teachers, and our staff. So then how would you do that in our schools? What are the layers of measures that we put in together to reduce exposure and reduce risk? The first is nobody can come to a school building if they're sick. And as a parent, I've been guilty of sending my 3 kids at different times to school with a sniffles or a cough, or even having taken Tylenol. But we can't do that anymore. I certainly won't be doing that myself, and we certainly hope no one will be doing it. And we're going to be strict education about that. And that goes not just for students, but of course for the staff and teachers. The second is you need to reduce the total number of people entering a building and the size of the classes themselves. And that's why in New York City, we have a hybrid approach that combines remote learning with in-person instruction. The classroom sizes are going to be shrunk to really about 1/3 or even less of what they would be normally. Next, everyone who does actually enter that building must wear a mask. Literally everyone. Many European countries actually do not require a mask for children less than 10 years old. We actually disagree with this approach. And we in New York City are going to have probably the strongest mask mandate that I've seen anywhere of in the world. Related to this, all teachers will also be provided with a medical grade mask, something that we provide to healthcare workers, and the option, if they choose, to use a face shield, because the teachers are in the classroom 5 days a week. Next, we have to keep all of the desks spaced apart, and we're focusing on keeping them 6 feet apart. Some countries around the world have opted for 3 feet or even less, no distancing in certain young age groups. We disagree with this and really want to ensure physical distancing at all times. There's no magic to 6 feet, but it is really the understood global consensus on a safe distance. And next, we have to improve the ventilation in all of the classrooms in the buildings. Some of this will be through windows, some will be through central air systems, and some will be through air purifiers in individual rooms, and some will be a combination of these. And then finally, if an illness does actually occur or a case is confirmed, we really need to pounce on it immediately and communicate consistently and clearly to everyone about our investigations and the basis for our decision. Here in New York City, we have the largest, most successful testing and tracing program in the country, and we're committed to doing this as effectively as possible in all of the schools. And so I have personally reviewed the protocols and procedures from around the world, from the UK, Europe, and Asia, and I can personally attest that ours are as rigorous and thoughtful as any. Health and safety really must be at the center of our planning. That's the commitment that I've made to my family, and we in New York City are committing this to our students, our teachers, and our staff. Thank you.
Jay, thank you very, very much. I really appreciate it. And I must say, the New York City has a very impressive set of guidelines for opening. And, we're going to wish ourselves all well here in this. Will this all work? Will we be able to avoid new outbreaks? Will the schools actually become a hotbed for rekindling, potentially a second wave here? I don't know, but I can't think of anything at the moment that the schools should be doing beyond what they are doing. And And I think underlying all of this is the fact that we have a lot of children who need to get educated, a lot of children who need to have the disruption in their education addressed so that we can get them back to learning, which is what they need to do and desperately need to do. That said, I'm torn. Also, I'm a grandfather of 4 children who all go to the New York City public school system. So our whole family is like absorbed in this nonstop discussion about what needs to happen and so on. Not everybody's going to agree with reopening the schools. Like on the initial date being September 10th, and I think that's now been pushed back, and there's still issues, and some of our panelists are going to take issue with everything about it. And then we'll hear from later on in the panel from Doris and Cynthia about what's going on in their communities and what they're experiencing as parents. But I just want to make a few introductory remarks as sort of background, and mostly, first of all, the status of COVID in the United States is still a very serious problem. We're getting 1,000 deaths a day from COVID in terms of the whole United States, and that's a crazy high number that we need to be thinking about. This is part of the national context. We're close to 185,000 deaths, and that also is going to continue to rise no matter what we do here in New York City. There's other parts of the country where the infection rates and the not and all that is a much different place than New York City is. So it's just worth recognizing. Now, the 6 million confirmed cases in the US, I just want to remind people that Dr. Redfield, the head of the CDC, made this comment a few weeks ago, and I very much agree with it, that the tested confirmed cases represent only a fraction of the actual total. A lot of people haven't been tested but have the disease, and it may be a difference of 10-fold here. So if it's 6 million confirmed by testing, I think it's fair to think of the fact that we probably have about 60 million cases. I'm not surprised about that, and Jeff Shaman may want to talk about this later too. It's most of us who have been thinking about this for some time suspected that half the US population, or 160 million people, could eventually be infected, although the vast majority might be asymptomatic, and hopefully that will be the case. But what we're seeing are these geographical waves of outbreak, which were horrible in New York and the Northeast in April, and have now migrated to big outbreaks in the Sun Belt and other parts of the country, and rural areas in particular. And maybe Cynthia, Dr. Cross will make some comments about this. There are rural areas, especially in the South, where the outbreak is really taking hold, and where healthcare access and quality are extremely limited. So we're going to have outbreaks in areas that might be sparsely populated, but where assistance and medical support may be something far less than desirable, obviously. So we'll have problems on a national basis that aren't going away. And I think Dr. Varma's point about the fact that we have a long way to go, and being able to apply multiple strategies to keep things under control, not just in the schools, but in our communities as well, is very well taken. So what's the status with children? And there have been about 500,000 cases of children around the United States that have come down with COVID. And some recent studies have shown that this rate is rising. Now, children still tend to have, there were about 5% of the total COVID-infected population. About 5% of them were children in late May. It's now up to around 9% of the COVID cases are children. Children aren't getting as sick so far as adults do, and we're hoping that stays true. But the fact is that there are a growing number of children who have gotten very sick and have been admitted to intensive care units. So I don't think this is in any way a stable situation, and we can expect more challenges around children in general. I think that's just important to note in terms of the background of as we proceed in New York and nationally to reopen schools and bring children back into classrooms. The other experiences we had, of course, there's been big outbreaks in a number of summer camps. Some private schools which have reopened are also seeing outbreaks. So, but I don't think any of those places, the camps certainly, and even the private schools, have been preparing their schools to the extent and the degree to which New York City is managing its public school system, which is all good. I want to say something though about children who are maybe asymptomatic, which is why we need to have as much testing as we could possibly muster. We may have a lot of children who are asymptomatic with COVID, and in the 6 months until now, we've lived in a bubble where children are home and only surrounded by their nuclear family for the most part. Now we have children going to school. They'll be in congregate settings. There's 55 or 56 million children in schools in the United States. If they get infected asymptomatically, they're going to be coming home to their families, including not just grandma and grandpa who may have serious risk, but also their parents who may have all kinds of pre-existing conditions, from weight issues to diabetes and so on. So I think we're going to potentially be creating a risk pool for families, for children who may be traveling with the disease asymptomatically, which is one of the reasons that testing is so incredibly important. In general, this decision about sending your child back to school and whether it can be done safely or not is absolutely the most controversial, the most angst-producing, and the most stressful decision point we've been at since the pandemic began. You know, the pandemic was, you know, we'd have outbreaks and everybody would be concerned, obviously, and the deaths and everything about it. But now we have a decision point that is affecting every single family. You know, it's like we have a bunch of experts and people on this call right now, and like Dr. Varma was saying, many of us have children, families, grandchildren, and so the decision about sending our kids back to school is a different nuance than whether we're reopening the school. So yes, we're going to reopen, or no, we're not, or we're going to do it all remotely. But then if you keep going down the trail here, we end up with mom and dad having some very, very difficult decisions to make when the option is, do I keep my kids fully remote, or do I send them back to school, even in a hybrid setting? So I would conclude my remarks by saying, you know, I've worked for my entire career as a pediatrician dealing with low income and high adversity children living in high adversity, high adverse circumstances. And my feeling about the need for children to stay on a successful educational track is an extraordinarily high priority for me. And I think this is what we've been dealing with, getting kids back in the educational system, where, by the way, you know, there's 200,000 kids of the 1.1 million children in the New York City public health system, public school system, who have special needs. And many of those special needs are cared for by special programs in school. So I'm worried about those 200,000 children, where they'll be getting those services if they're not in school. So I think I'll leave it at that. And, you know, all of us, you know, the teachers, all the faculty, and Ann's going to talk about this, have questions and may be at risk and want to know that they personally are going to be safe, as well as the children that they're committed to taking care of. And, you know, I guess my final point is the issue of testing. I'm extremely concerned that we're not doing enough testing to reopen the schools. But the good news is that I think within a few weeks, there's going to be availability in huge numbers of what's called point of care testing. So for those of you who are listening, this means that as opposed to having to have a sample go to the laboratory, that a small amount of saliva or a very gentle nasal swab rubbed on a strip, plastic or paper, will be able to determine within 20 or 30 minutes whether there's positivity for the virus. Not talking about the antibodies, which we get from serology, but actually knowing whether somebody who's got symptoms or not symptoms, what we're doing screening and surveillance, whether there's positivity there or not. That's going to be really important. I was hoping to have one of those samples ready to show you right now, but they didn't arrive. So that's the good news. It's coming. And I'd like to now introduce the moderator of the panel, Jeff Schlegelmilch, and Jeff is the director of the National Center for Disaster Preparedness at the Columbia University's Earth Institute. Jeff is extremely experienced disaster expert, and he's taken over the helm of the National Center as of July 1st. My colleague and friend, Jeff Schlegelmilch.
Great. Thank you so much, Erwin. Thank you, everyone, for tuning in today, as well as our esteemed panelists. I'll be very, very brief in saying just a few things and covering a few ground rules. But just that, one thing that I'm always reminded of is there are no bystanders to this pandemic, right? Everyone is affected. Everyone is a part of this in some way, directly or indirectly. And, we're reminded time and time again that every environment is different. Every school district is different. Every facility is different. And no one knows this more than parents, right? Trying to navigate whether or not their kids can go to school with so much uncertainty around the virus, around how it's transmitted, around what the cases are in the community, et cetera, et cetera, et cetera. And, with this guide that Dr. Redlener and Karen Redlener put together, I think is really important in the sense that there's never going to be a formula where you plug in a few variables and it tells you exactly what to do. I wish that were the case, but it does give you the questions to begin to ask. And I think at the end of the day, what we're really looking for is that, if you're looking at the picture wholly, if you're looking at the from the perspective of your family and the decisions you have to make, and are making the best possible decision with the best possible information, that's the most achievable goal that we have right now. And as we go through the conversation today, I think we'll hear a lot of different perspectives. But ultimately, I think we'd certainly trust in the answers that you choose for yourself and for your family with this information available, that at the end of the day, it's a very personal decision on what to do and how to do this. And it's not lost on us how challenging it is, as well as how much it's kind of a moving target as more and more evidence emerges on how this virus is transmitted, and it's a shifting landscape. So with that, so some folks have already seen, so what we'll do is we'll do a brief kind of walk through the moderators, and we'll ask a couple of questions. And if you have questions you want to ask, please go ahead and put them in the Q&A section at the bottom of the screen there. And we'll go ahead, we'll get to as many as we can. We'll try to batch them together for ones that are similar. I am seeing a lot of questions about New York City specifically. We'll certainly try to get to some of those to the extent that we can, particularly with Dr. Varma on board as well too. But I also just want to caution that we're really set up here to look more nationwide and look at a variety of different environments. We may not get to these to the level, and maybe Jay, in some of the comments later, we can point some folks to where they can actually engage in more depth with the New York City specific information, but we appreciate all of the questions and all of the thoughts and insights, and we'll get to them as many as we absolutely can. But with that, why don't we go ahead and just kind of briefly go down and introduce the panelists. What I'll do is I'll actually introduce each panelist and then ask them to answer one question right up front, which is that we have such a great diversity of perspectives here today. As if you can just let us know from your perspective, what is one of the most important things that you're concerned about or that you're thinking about when it comes to reopening schools, or if your child or someone else's child should return to the school. Recognizing there's no one single answer, there's no one right answer, but from your vantage point and what you do, what is one of the most important factors that you're thinking about, or cluster of factors, if that makes sense. I have a bad habit of asking complex questions that are hard to answer, so but I appreciate your patience. So first up, we have Ann Goldman, who's the Vice President of the United Federation of Teachers and also a nurse, and a strong advocate from that perspective. So Ann, thank you so much for joining us, and I'm curious your thoughts on sort of what rises to the top in terms of what you're looking at and what you're concerned with.
So I think some of that was in the introductory remarks. I think we have had the opportunity to hear the health and safety piece, which is the critical piece that brought all of us into this crisis. That said, outlining a secure plant environment, that we have 1,600 school buildings in New York City, and we have, yes, 1 million children, and we have 120,000 workers, all of whom have families who are quite concerned. So to be able to identify what depicts safety and health is critical, not just for them, but for the city. We remember how the city looked in March and April, struggling through the pandemic We don't want to revisit that. And what we do want to do is create a safe haven in our schools to welcome back the children and families who have been isolated, who have been challenged to navigate a very difficult environment in our times. And as you said, there is not a silver bullet or one size fits all. We have multi-generational homes where we have culturally witnessed the fear, the angst associated with this horrific disease. What we have to do is have outreach in the community that secures our schools as a forum that is safe for those functioning, but we also have to educate in our communities the families so they have confidence to identify and move forward. This is a new phenomenon in terms of reaching out in a culturally appropriate way. What we can look to is just a few weeks ago, our city in New York was challenged with very high data in Sunset Park. And I think what we can do is use that as an example of how to respond to just challenging data where what happened was everything right. The health and safety people reached out, the educators reached out, we reached out to the families to assess and identify their concerns and needs, and we were able to respond and bring down what was an escalating phenomena. So what we're going to have to do is navigate hotspots. We're going to have to navigate the ability to be sure children are not denied, depending on where they live, the opportunity to engage educationally. We have to be sure they're nutritionally supported. The only meal a lot of children get in New York is from their schools. We did a grab and go program throughout the months that has been useful. We are the forum and navigate for families a safe haven in many different ways. These months have brutalized us. So through the lens of representing Michael Mulgrew today, we are enthusiastic about reaching out to each and every child, but recognizing the phenomenon of this disease has an ongoing challenge to our health, to being isolated, and to learning. So our goals are to focus on offering individual support for families to make the best decisions they can to join us, whether that is blended learning, whether that is in fact all remote, depending on the age of the child and where you live. You know, choices are not dictated by us on this panel. They're dictated by life circumstances. So we can give the best advice in the world, and it's really irrelevant if you have to go to work and you have a child that needs child care. So what we want to do is identify that we do not have all the solutions, but we want to facilitate the support that is needed for all our families in our communities to reach forward, to join us in the educational system so we can help launch learning in an appropriate way for each of them. And as to special education, let's just note for those of you who may not be as familiar with that, we provide occupational therapy, speech therapy, physical therapy. We do hands-on diapering. We do tube feedings. We do dressing changes. It is a very intimate, physical, challenging role on behalf of our students that in fact need that support and help, which is why as you began this forum, we heard the medical piece. That's essential. To ignore the ability to safely introduce medically fragile children back into the system is to see it again explode, as so many other systems have. So we want a welcoming, secure environment. We want to finesse the educational outreach, and we cannot dictate how people choose to move forward. Thank you.
Thank you so much. And I think such an important illustration, right, of how schools are, in addition to being essential educational centers, are so much more than that in the lives and fabric of children and of the community. Great way to get started. So our next panelist is Dr. Cynthia Cross, the Division Chief of Pediatrics at Le Bonheur. Did I say that even close to right? Medical Center in, I'm sorry, I lost my notes here. Here we go. Hospital in Memphis, Tennessee. She's the medical director of the On the Move program there and is also an assistant professor of pediatrics at the University of Tennessee. Thank you so much for joining us, Dr. Cross. And I pose the question to you as a pediatrician, and from your lens, what are some of the things that are really on your mind right now?
Thanks, Jeff, and thanks, Erwin, for the invitation. Good afternoon, everybody. I do hospital medicine, and I get to see, of course, kids who have been infected with COVID, also children who have had the multi-system inflammatory syndrome that's seen in children. But I also have the pleasure of working with children in the community through our Lebanon on the Move mobile unit and working with school nurses. When you think about this epidemic in terms of a timeline, I think back to when kids left school in March, and we really thought they would be back in by late summer, early fall, and that obviously has not happened. During the interim, we've learned a lot about this virus. We have lost many of our friends and loved ones, and that has created fear and panic. Also, with what we've learned about the virus, our recommendations have changed, and I think that has unfortunately eroded some of the trust that people place in the scientific community as to what they should do. The school is so important for kids, and as Anne stated, it's much more than just learning the academics. It's the social interaction. It's the kids who receive their therapies at school, kids who otherwise wouldn't be nurtured if they didn't have the school system and the teachers. There is even concern that physical abuse may be underreported now because many abuse cases are identified by teachers. And so you look at getting kids back to school, so important, and so many issues to think of. So the individual child, do they have special needs? Do they have health conditions that may be worsened if they were to become infected with COVID? Are they living in multi-generational homes? Are their parents frontline workers? We do know that children of first responders and frontline workers have been especially hard hit because their parents have to work. If you're middle class, upper middle class, and you have a job that transitioned very well to staying home, then you could do that. So this may not seem as big of an issue for you, but for families who are living in poverty and kids whose only hope is to get a good education, that whatever we do will have ramifications for many years to come. I've been impressed by the educators in our area. We've had multiple school task forces, some of which I have sat on, and our school systems are very different. We have the big municipal school district, the Shelby County school systems, and after much deliberation, they've decided to stay virtual for a while. Right around the time they made that decision, many parents lost the electricity to their homes because the moratorium for electricity ran out. So now you have kids at home who are supposed to be learning virtually, and many of these kids were already behind, and now they're falling further behind. So I think all the effects of poverty tie into learning for these kids. You also have multi-generational homes, as Anne stated. So maybe there's someone in the home, an adult caretaker, who would be devastated if that kid brought COVID home. So what do you do for those people? And then you have parents who are just fearful about sending their kids back to school. And how do we support everybody and get kids back to school safely? This is a human issue, a medical issue, and as previously stated, there's not one size that will fit all, and I think we have to listen to each other and be respectful of other people's opinions and their fears, and see how we can get most, if not many, of our kids back to school. I think it's important enough that we're just going to have to keep working at this until we can help as many people as we can. Thanks.
Thank you so much. And, I'm always reminded, a lot of the work we do at the center too is recognizing how connected kids are with so many other aspects of the community. And as a pediatrician, I appreciate you sharing the perspective on how all of these things sort of come in with the child and go back out with them and are connected to so many aspects of the community. And I know a lot of our work too has been very centered around understanding through that lens, because you really do get to the state of the broader community through the eyes of the children and through those connections. Also grateful for pointing out that there is a disproportionate effect of this disease on communities. And I know we'll get into some of these disparities even more as we go through the conversation. As we go through the panelists, our next panelist, we've talked a lot about some of the different psychological considerations, and a couple of folks have already mentioned some of the mental health issues. Our next panelist, Dr. Paul Madrid, is a clinical and forensic psychologist specializing in trauma and disaster response, and has been with us at the center on our adjunct faculty as well. Dr. Madrid, same question for you from your lens, from your perspective. What are some of the things that you're concerned about, some of the things that you're thinking about right now?
Thank you so much for inviting me to participate. As a mother of a 7-year-old who attends a public school, a wonderful school in Greenpoint, Brooklyn, all of this has been pretty much on my mind essentially since March 12, 2020. And so, it's definitely something that I've considered quite a lot from the personal and of course, professional perspective. I'm also a clinician speaking with families remotely, virtually on a daily basis about the different things that are going on. Most of it has been the pandemic impact. What's on my mind, once you've discussed factors such as community infection and spread rates, parent and caretaker work options, issues of family health and vulnerabilities within families, finances, nutritional needs, and of course, even access to the internet. I mean, those are really, really critical issues. But as a psychologist, I'm thinking a lot about, what can we do, regardless of what decision we make, to foster our children's resiliency, to foster their ability to essentially bounce back from a difficult year, to make this perhaps a year of growth, to find ways to create stability in spite of everything that's going on. So really that's what's on my mind. And I think that's what's going to be critical long-term. I've also been thinking a lot about the many, many different roles that the education and that going to school in person play on a child's lives. And I think that, the learning piece, but of course the ability to socialize. So I've talked to my friends and to my patients a lot about this, in what ways would you be able to meet those needs? I mean, there's many more things that education and going to school really take care of, but how do we meet at least those needs? What can we do? So would a virtual approach be the right one for you based on that? I know that other parents are also very, very concerned, and rightly so, about, the interpersonal and socializing ability, needs that children have. I know for my 7-year-old, that has been a very, very significant challenge. And so, with those in mind, I think that we can potentially find ways around it, find ways in which we can provide certain opportunities for them that are, safe, or at least as safe as possible, regardless of what we choose. I think that children are really resilient. They're strong, they adapt, they understand beyond their years. But I also think that there's things that we can do in order to make that transition to either virtual or in person or a combination be better. I always start with the parents. And so, parents and caretakers' well-being, welfare is crucial. In my opinion, it will make a huge difference in how children react and adapt and manage and really view the situation. So whatever we can do ourselves as parents and caretakers, and whatever the community can offer us, so that we are okay, and so that we feel empowered, informed, and educated, I think will make a huge difference. It will inevitably be a part of what the child will respond to. So that's essentially number one in terms of the psychological realm, in my opinion. I also realize that there are children with special needs. And so that is definitely something to consider, to take into account, and to perhaps find ways in which we can meet their needs. I worry very much about those children. I'm thinking, for example, about children who have pre-existing high levels of anxiety or learning difficulties or issues of adapting to different environments. So those are pretty much on my mind, and I worry that without proper support, they may be the ones that may suffer more so than others. Starting a new school year is challenging for everyone. It's challenging for parents, for children, no matter what. And challenging by that, I mean, there's a certain level of anxiety. There's the expectation of what's to come, the challenges of learning new things, etc. And so having conversations about all of this will be really, really key as well. And acknowledging and asking children what their opinion is regarding mask wearing, practicing wearing a mask for extended period of times, perhaps, if that is the school requirement, which in my opinion should be, I think will be key. It's really kind of like training our children for what's to come. If they're going to be attending school virtually, perhaps we need to start getting up earlier. I am guilty of allowing my child to go to bed later and waking up later. It gives me time to do more work in the morning. So I know that I'll be making some changes really very soon. So preparing for what's to come, having the conversations, normalizing feelings, figuring out what our self-care plan is going to be. I find these issues to be as critical as any others that we're talking about here, because they will in many ways determine, or to some extent I should say, how well the children do, regardless of what the option is. And so, with that, I thank you so much for allowing me to participate. I'm excited to hear more.
Wonderful. Thank you so much. And so grateful for your time and for your perspective on this as well, too. And I really appreciate that point on, not all children are the same, and also the role of the parents in supporting the parents as a means to supporting the children. And so I think also a really, really important thing to carry with us. And believe me, I am guilty as well, too, of the floating bedtime, sort of scaling a little later and sleeping in a little later. And as school gets closer, gotta get back on that schedule. Yeah, thank you. So next we have Jeffrey Shaman, who's a professor of environmental health sciences at the International Research Institute for Climate and Society at the Earth Institute, and also director of Climate and Health Program at the Mailman School of Public Health at Columbia University, and brings a wealth of expertise as an epidemiologist and really on the public health and population health side. So Jeff, it's probably a big question to simplify into a couple of sentences, but what are your thoughts in terms of what are you concerned with from your perspective? What are you thinking a lot about right now with schools reopening?
Well, thank you for having me here, firstly. I'm going to take the advantage of, that is my professional one for starters, which is I'm an infectious disease epidemiologist. And I'm going to pick up with some of the points that Dr. Varma talked about. And that is that, looking broadly into the community and saying, what is an environment that's more or less conducive for considering opening schools? I think the 3 points that he laid out are exactly what we've been advocating, and as he would, which is that you want to see a low community infectious rate, you want to see low positivity rates in the testing that's given, and you want to see that reproductive number for the community that R is well below 1. And New York City does meet all 3 criteria. The issue, though, is that when you bring schools in session and when you have kids coming together, you're essentially having daily mass gatherings of children, teachers, and staff. And you're having them coming back together. And mass gatherings are something in the context of an infectious disease pandemic such as this, particularly a respiratory one, that you really want to avoid. So if we take the proposition that children are part of the transmission cycle, which it certainly appears that they are. We could argue about whether they're less so than adults, but as long as they're not zero, bringing them together on a daily basis in school is going to provide more opportunities for transmission of the virus than if you didn't do it. It's that simple. The question then becomes, what kind of school environment can we create that makes it safe within the schools? Certainly those 3 factors we talked about, which are outside the schools, which are the community infection rate, the reproductive number in the community, and the positivity rate in the community, those are things that we can monitor and use to gauge whether things have gotten to a point where we're concerned about the movement, the propagation, the level of prevalence of the virus in the community, and that it might be advisable to actually back off on having schools in session, that it may be exacerbating things. One thing you could sensibly ask is, what's the cutoff level? And the answer is we don't know. We're all collectively doing an experiment with this. We can see what some other countries have done and how they've been successful and how they've not. We can look at other school districts around the country and see what they're successful, but it's very hard to get a precise number on this. The second thing that we can look at is we can think about what are the controls that we're putting in place in the school environment. If we're going to have the schools in session, and if some of the children are going to come into school, and the community infection rate and the reproductive number and the positivity rates in the community are low and acceptably low, what are those controls that we can put in place? And Dr. Varma outlined them. We need a multi-pronged approach. We need temperature checks. We need thinning of class sizes. We need bubbling and isolation. We need a requirement of mask wearing. We need social distancing. But the question then is, well, what's enough? Do we know? Can we quantify it? And the answer is, we don't have the answers to any of those questions. We don't know what the gain is from wearing masks. We don't know what the level of compliance that we could reasonably expect, even if we did know what that gain is. We don't know what social distancing does because we actually don't know how the virus specifically is transmitted and what's going to provide an opportunity and what won't. So it becomes a bit of a black box, unfortunately, where it's difficult to dissect whether or not what you're doing in school is enough. Now, certainly from what I've heard, the Department of Education is really taking this multi-pronged approach. It's trying to do so. It's trying to improve ventilation. It's trying to open up the windows in the schools. It's trying to thin class sizes. It's trying to clean and disinfect. The question will be, is it enough? Do they have the resources to really pull this off? My daughters both go to public schools. I'll tell you, my older daughter goes to LaGuardia. LaGuardia has almost 3,000 students in it, in a building where many of the classes don't have windows, let alone windows to open, and where there is no cross ventilation. And we've just had the conclusion of the parent body there saying that there aren't enough resources and there have been cuts to the budget to provide the cleaning products that they need. This is the reality, the backdrop reality against which we are working. And it is a very difficult, complicated situation when resources are limited to provide the kind of in-person education that we would like. Now that also, I have to recognize, and this has been already articulated by others on this panel, that there are really devastating consequences for not having children in school. And we have to recognize that and do the best to mitigate that and put that into our risk calculus and understand that this keeps working parents from being able to work. Understand that they're children with important social, emotional, and intellectually growth needs that need to be attended to, all children really on that level, and that not doing so is a public health issue in and of itself. How to balance that is a very challenging question, and I can't tell anybody where to really come down hard on this. But the problem that I foresee as an infectious disease epidemiologist that we have to be very careful about is that not only are we going into a season where we're opening up the schools, we're also going into a colder, drier time of the year. And this virus exhibits some tendencies and evidence that it is in and of itself seasonal, in that it is more transmissible as we move into the wintertime, innately. And that this may be tied to atmospheric conditions. It hasn't been enough to stop the transmission in the summertime, but it make it more transmissible as we move into October and November and December. Furthermore, more broadly in the community, people are going to be spending more time indoors. And indoors is where the action happens for the transmission of respiratory viruses. It's where people are in closer proximity. It's where there's less air ventilation. It's where the opportunities for person-to-person transmission are heightened. So that is going to be happening more broadly in the community. At the same time, schools are going to be ramping up in session. And so one of my concerns is that as we have not only the schools opening, but environmental factors making the virus more transmissible and people spending more time indoors, that this could really take off in a way that would be detrimental. So we have to be vigilant. If we go forward and people choose some hybrid models and some in-person models and some remote models, which the New York City DOE is offering all, then we need to actually be very careful and willing to pull the trigger to reclose schools if things get out of control. I'll stop there. Thank you.
Thank you, Jeff. And I very much appreciate, we talk about the cascading impacts of this pandemic, and it sort of, everything from funding to social inequities, things like that. But of course, it all begins with the disease agent itself sort of spreading in that environment that it's set up for. I appreciate just the insights, and also the fact that, the infection rate is not a steady state and is not necessarily something that could continue to be one, and the need to have to throw out the playbook or adjust it in the face of what's happening is a very, very real possibility. Moving along, we're joined next by Lisa Sachs, who's the director of Columbia's Center on Sustainable Investment, and is an adjunct assistant professor of international and public affairs at the School of International Public Affairs. Lisa, thank you so much for joining us today as well too. And same question, coming from your perspective, what's on your mind these days? Quite a bit, I imagine.
Thank you so much for having me. And obviously, as you can tell from my title, I'm joining very much in my personal capacity and from my passion. I'm a parent of 3 elementary school age daughters in New York City public schools. I'm on the school leadership team of our public school on the Upper West Side, and I've been a longtime passionate advocate for New York City public schools, but also concerned about even pre-pandemic inequities in the school system, underfunding for classrooms, learning, et cetera. So obviously the pandemic just exacerbated a lot of the concerns that I already had. And as Dr. Redlener knows, this has become all-consuming for me. I'm a huge consumer of all of the research and advice from Dr. Redlener and Dr. Shaman and other colleagues at Columbia. So I'm really grateful to be part of this group. I would just highlight 3 concerns, both from a parent's perspective and from a public school advocate's perspective. I'd like to just quickly touch on each of them. They're safety, education, and childcare and social services. And I actually think that it's important to take each of them separately, because my perception of the way that New York City has been thinking about this is that by trying to address all 3 of them at the same time and with the same tools, we're actually undermining our goals and considerations in each of them. With respect to safety, I can't compete with the experts from which I'm learning. I would say from a parent's perspective, I'm really concerned that even in New York City, where we're managing right now the pandemic, our levels are still substantially higher than in other countries that have managed to safely reopen schools. So I'm proud of New York City and grateful that we've managed to suppress transmission for now, but I don't think that we're anywhere near the level that would allow us to move forward safely, particularly as Dr. Shaman just emphasized, and I had read from what Dr. Redlener had sent, that we have such limited understanding of transmission and mitigation measures and what's successful. A lot of the New York City reopening plans are pretty much hinged on the idea that with fewer kids in the classroom, we'll be able to manage. I don't think there's enough evidence to support that. And there's also a major disconnect between what the city is saying the schools will be able to do and what the schools are actually able to do. That I know from my position on the school leadership team. Our school, which is in a relatively well-resourced part of the city, still does not have a school nurse. We don't have a janitor. We have faucets that require you to hold with one hand while you get the trickle on your other hand. I haven't heard any plans to replace the faucets. Our parent-teacher association, which is rare among New York City public schools, is being asked to fund full-time teaching positions and aides that are necessary to make this hybrid model work. We're being asked to fund, or the parents are volunteering to pay for thermometers because the school doesn't know how many thermometers we'll be able to get. So the DOE is announcing a lot of plans that are hoping to reassure parents about the safety, but as a parent, I'm not seeing evidence that the schools will be able to manage that. My second point was on education. I honestly have not heard enough of that from my perspective with this school reopening plan, which is wanting a pedagogical plan that actually makes sense and that allows for continuity and excellence for the students, that has teachers teaching grades and subjects for which they're trained, and a plan that allows for the inevitable cases that will emerge, kids that have to quarantine because of exposure even when their classrooms remain in session, or other illnesses, or indeed the risks that school pods or classrooms or schools will close altogether. To my mind, this means that we should really be using online tools for remote learning more effectively. We need synchronistic learning and platforms that keep kids engaged and enriches the curriculum. And that doesn't make parents have to choose between working or homeschooling, or, by the way, hiring tutors, which many families that can afford to in New York City are doing, which is going to massively exacerbate the existing inequities. Planning for remote learning, which is going to be necessary under any model, requires planning. And I don't see that happening. Some schools did this very well in the spring. Many schools did not, which accounted for a lot of the students that dropped off. I have to say, I find it quite disappointing that today's announcement in New York City that we're postponing school reopenings doesn't plan for any type of remote instruction on the day the school was supposed to start. If we had been preparing for this earlier on, I think we could have brought kids back with their peers, with their teachers, earlier on, using tools that would have helped us connect and allowed us to pivot in and out of the classrooms as necessary as this pandemic evolves. And the final point, which I would make separately to the point on education and safety, is a separate plan for the safe provision of social services and childcare. And I don't think that that needs to be tied up inextricably with the teaching question. To my mind, the questions we should be asking is, our district optimizing available safe spaces, the safest spaces that the city has access to, which may or may not be schools, to maximize childcare, to support remote learning, to support students' access to the technologies they need and the support they need to participate actively with their peers and their teachers remotely, to provide the social services and the therapies that are critically needed, to provide the meals that are critically needed. In New York City, rather than scaling up the enrichment centers that we had in the spring that provided these services, the city, from what I understand, seems to be shutting them down in favor of a model that has kids in schools 1 to 2 times a week. And now looking at, surveying parents now in September about whether student parents might want some other type of childcare arrangement on the off days. I think that we should be looking at these questions separately, because it's a different challenge to safely provide safe learning spaces for children, and therapies and social supports that don't need to be with teachers, and that can be in buildings that might not be school buildings, while enabling the continuity of having kids connect with their peers, with their teachers, in an uninterrupted way through online learning. So maybe I'll leave it there. That's what's been on my mind.
Wonderful. Thank you so much for sharing the perspective. And I know that, really everyone here is sharing, sort of wearing multiple hats, right? Many are parents, in addition to, whatever position they take in terms of the expertise in front of us, and just very, very grateful for your thoughts and advocacy. And it brings us to our final panelist, and one I'm really looking forward to hearing from as well, too, coming to us, again, as a parent, looking at this as similar, Lisa, to you, from the perspective of a parent looking at this with a child in school. And so Doris Stevenson, coming to us from Mount Vernon, I'm just really grateful that you made the time to join us here today, and would really love to hear kind of from your perspective, with all the things going on around and all the guidance coming out, what is it that's on your mind the most with this transition going into school? What are your thoughts and perspectives that you want to share with us today?
Okay, thank you, Jeff, and everybody for being here today. I look at it through 2 different ways. I am a parent of a high schooler at this point, and I'm also a daughter of a teacher who teaches 3rd grade in New York City. So my perspective as a parent is that my child has an underlying condition, which is asthma, and I chose to do totally remote because I feel that that's safer for him. Also, he, disagrees with me because he wants to go into high school his first year, and I can totally understand that. But as far as his health is concerned, that's one of my main concerns. In Mount Vernon, the school district here has chose to go totally remote for everybody until October 2nd. So they have, really went through every idea that they could think of to open up the schools, but they chose to not do it right now and really work on more to actually be prepared on October the 2nd to open up in a hybrid mode as well as remote. So I am really sticking in my heels as far as him being remotely home based on his health and that kind of thing. So I'm really totally done with that. And as a perspective of my mother, who's a school teacher, I also hear her side of things, which is very hard because she also has an underlying condition as well. And she should not be in the schools teaching. But that's where she would want to be. You know, we all want our kids to go back to school and we all want teachers to be there. But at the time that we're in, it's just not possible for me to see a way of this happening. And, you know, she feels for her teachers, for her students, I'm sorry, that, you know, she, when they had to leave the school in March, she really worked hard on learning the remote thing and talking with her students. And she has students who live in, you know, poverty-stricken areas, and she is really concerned for them as well. And, you know, I see it from her perspective where she is on panels and she's trying to come up with ideas of making this going back to school work. And it's just stressful. I see it from her side where she's very stressful in a sense where, you know, coming up with some kind of ideas of having this happen. But, you know, we listen to the news every day. We see the mayor, we see the governor, we see everything. And the plan for, you know, the school chancellor is just not making any sense to any of the parents. You know, it's just not making any sense. I was on a board meeting last night with my child's principal, and there was no answers to any of the questions that the parents had as far as air quality in the schools, how are the students going to protect themselves while they're eating with the mask off, how do you keep the mask on the kids, like how is this all going to happen? There were no answers. There were no answers at all. And I just think that, you know, from my perspective and my mother, who was a school teacher's perspective, is that remote for right now is going to work. I just think that right now, the 2 weeks that they have, that the mayor has suggested will happen, is just not enough time to figure everything out and to get schools back up and running. I just don't have any confidence in it working. So, I mean, I continue to pray that things will get better and maybe there will be a way to, you know, open schools in a safe way, but I just don't see it, you know. There's a lot of things they just have to like look into and figure it out. But right now I'm choosing remote, and that's the way we're going. My mother is, you know, going to do the best she can as a teacher, and she's a great teacher in the city. And she's going to do whatever she has to do remotely for her kids and to just keep them, you know, healthy as possible as she can, emotionally. And, you know, she is 100% a support for them, which I respect. And, you know, I'm just going to be as supportive for her as well as my, you know, 14-year-old who is a freshman in high school right now, who will not be able to have the experience that he wants.
Thank you so much, Doris. We really appreciate you sharing your perspective, and very personal one at that. And, you know, just very, very grateful as well, too. You know, it's, you can let your mother know as well, too. I think there's a lot of folks cheering in her corner, too, and very appreciative of what she's doing to try to be there for her students as well. So very, very grateful that you're with us today and to help all of us frame this and understand it. So thank you. Great. So I'm going to move into the more broader question and answer now. So as folks have seen, you can go ahead and put your questions in the Q&A. What we may do is if we sort of answer them in clusters, they may get dismissed. If you can put it back in if we didn't get to it. I can tell you right now, we won't get to all of them, but we're going to do our best to get to all of them, as well as get to a couple of others. But I thought I'd start out with, there's a whole bunch of questions that have come through clustered around kind of two clinical issues. So I thought, you know, some of them are around temperature checks and doing temperature checks for folks as they come and go. That's a very visible thing we've seen in a lot of places. And Jay, I'm wondering if you can speak to that one. And then Jeff, we'll come to you next talking about testing strategies and, you know, what an ideal testing strategy would be and what some of the barriers are for that. But Dr. Varma, if you don't mind talking, you know, the veracity of temperature checks, is this something we should be seeing, not be seeing? What's some of the things you have around that?
Great. No, thank you for the question, and I appreciate all the comments from all the panelists as well too. So there's a couple of things to think about when it comes to temperature testing. So first is it a proven approach to you know, detecting and controlling COVID? And the answer is no. We don't actually have, you know, firm evidence that screening by temperature is highly effective, and we've used it not just for COVID, but for the original outbreak of SARS, for Ebola, and for a number of other things. So we don't have firm evidence to indicate that it's highly effective. The next is it still better than nothing? And I think the answer on that is pretty clearly yes. That, you know, simply by the act of having some component of monitoring of illness, whether it's direct temperature monitoring or questions or a remote app, whatever is used in whatever setting, you know, we feel that in the public health world, even in the absence of evidence, that this raises people's sensitivity, because as one of the things that I mentioned, one of the single most important controls you have is to prevent people with illness symptoms from actually entering the school. So I fall into the camp of people who tend to think that we can't, you know, rely on it as a strong control measure, but it can be an additive benefit to you.
No, thank you for that. I know that there's a lot of back and forth on all of that. And I think, you know, there's another question on there too about, you know, being able to create like the calculator to be able to put in the variables and decide what to do. And I think the uncertainty that you speak of here is sort of with all of these different things, and there's so much ranges of uncertainty, it sort of defies our ability to put together sort of some simple choices for some of these things. So.
Yeah, I mean, Jeff Shaman, I know can talk about it because we're on calls at least once a week together about, you know, trying to do modeling. And this is the dilemma with this disease. You know, you end up you know, the models give you a sense of direction and how to potentially change directions, but they're very hard to use at an individual level.
Yeah, yeah. Go ahead, Erwin,
if I could just weigh in on this temperature issue, it's really, this question is very emblematic of a lot of the challenges that we're dealing with around COVID. And, you know, so Dr. Varma says there's no good evidence, but it's the best that we have. In other words, the point is that we want to keep people that are sick out of the congregate settings and out of the schools and classrooms. And yeah, we do it, but we do it without real evidence that the temperature checks are actually evidence-based, reasonably good markers of whether children should be kept out of the classroom or not. It's not really sufficient, but it's the best that we have. And and I think that kind of answer actually applies to a lot of the things we're talking about. And Jay also said earlier that it's really this collection of things that we're going to do without knowing that any one specific measure is all we need or is exactly the right answer. For example, is wearing masks better or than physical or social distancing? We don't actually know that, but we're going to do as many of these measures as we can that may not have the evidence that we might prefer, but it is what it is, as somebody famous recently said. But that's what we're dealing with, the best that we could do. I don't know, Cynthia, did you want to weigh in from a pediatric perspective on this? Or?
Sure. I think it also depends on the way we measure the temperatures, right? Most people have gone to the scan thermometers, and I don't know if that's the most accurate way, but the most accurate way would probably increase transmission of infection. Upon entering work every day, we're doing temperature screens on everybody, and we've recommended that for the school systems. It's harder for the school systems than it is for the hospital because we have nurses at various stations. So how you do that is going to be difficult as well. And then what if a temperature occurs later in the day? What do you do with that kid? So no easy answer there either, but I agree with Jay. I think it's the best that we have right now. And if somebody is highly febrile, you will be able to pick up that person and turn them away at the door. The tough thing is most folks with COVID don't necessarily get big fevers. My daughter and I both had it in June, and neither one of us ever got above like a 99.7, which technically is not a fever, right? So.
one of the many sort of fuzzy boundaries of, of knowledge that we have. But what I'm hearing is if you have a fever, stay home, right? That much we know for sure. Okay, great. And so a whole bunch of questions around testing. Erwin, I know you talked a little bit in your opening remarks about, point of care testing and being able to do very rapid testing on the horizon. Jeff, I'm curious and actually invite everyone to join in on this, but I know you've been working with a number of different groups, not just schools, on what testing would ideally look like versus what it can look like under current circumstances. Curious your thoughts on that general sets of questions.
Well, there are a number of issues associated with testing. One is that for a defined building, people coming into a school every day, if you could have a kind of screen that was able to rapidly turn around and tell you with a high degree of what's called sensitivity and specificity, so it wasn't getting its results wrong, that was economical, that you could use to screen, that would seem to be a much better thing to do than temperature checks, which miss the fact that most people don't manifest with a fever when they're infected with COVID-19. And that there are periods of shedding before people manifest with fever during which they're contagious. So having that kind of rapid diagnostic would be great. But the reality is we have to walk it back because there are real complications. We don't have that kind of rapid turnaround test now. We don't necessarily have the money to implement it for 1.1 million school children in New York City. And we don't have the logistics to pull it off either, and actually have the people there doing the tests, interpreting it appropriately, sending people home who've tested positive as well. Lastly, if the test is not sensitive and specific enough, if it's telling you some people are positive when they're not and some people are negative when they're not, is it doing enough good compared to the chaos that's ensuing when you result in lots of people potentially being sent home who are not positive COVID, but being instructed to go get a more secure test and staying home from school for a matter of days? Are you going to have a lot of people in and out of the school system on a regular basis as a result of these tests, sending up flags that are problematic? In some sense, the temperature test is what it does is it gives you a lot of what are called false negatives. It's telling you that people who do have COVID are actually negative for it. It's missing all those people who aren't manifesting with a fever, whereas it's letting some people through who are in fact positive. The problem is when you start mixing this around, it can be very, very confusing and it becomes a logistical and financial nightmare. So the question is, what can you do effectively when you have a situation where it's worth testing every day or 3 times a week or once a week? And that's something that you can try to suss out, and you can look at this under the backdrop again of those community infection rates and that community reproductive number and the positivity rates to decide when you're going to test and if you're going to test more. But unless you have the resources with which to make this happen, it is a very challenging situation. I've done some work, for instance, for Hollywood and the Directors Guild and SAG, helping them decide how studios could actually go back. They have a lot of money. They have the resources and a small enough working group at each film set that they can begin to contemplate actually putting this kind of testing in place. Putting in place on a daily basis or a weekly basis for a school system the size of New York City is a much, much more challenging problem. So I think that's where we are. We're now at the point where ideally we would like something, but feasibility is a real problem.
Did you want to jump in, Lisa?
Yeah, can I just add to this?
Please,
I mean,
please
you've highlighted some of the tremendous logistical challenges and the great health risks from the temperature check as a model. Just to underscore from the perspective of our school trying to implement the DOE guidance on this, the additional logistical challenges, which is that, as I think I already mentioned, we don't have the staffing to take the testing, don't know how many thermometers we're going to get. We have to figure out as a school how the students who are not in session that day, because only 1/3 of our students are coming to school each day. The other 2/3 can come to pick up food at the same time that the students are coming into the classes. So there's commingling. We are meant to have an isolation room, but no staffing for the isolation room for kids that are sick. And then again, just to underscore probably my biggest concern, which is the intersection of this safety with the teaching. One of the questions we've been asking, for which there is no answer, is if students have any symptoms or have had exposure before a pod shuts down. So students, we want to incentivize parents to keep kids home if there has been any risk of exposure, any hint of illness. There is currently no way for those students to continue with their class if they're doing the hybrid model. There's no way for them to continue with their learning. The remote is happening with a separate cohort in the school. So I hope and trust this is yet another logistical challenge that the city is working on, but as of now, we don't have the systems and we don't have any guidance on absentee policies. So right now the systems are not in place to both encourage, incentivize, and then support parents who need to keep their children home if there's any risk that the kids might be exposed.
Thank you, and thank you all for helping to shine some light on that. I want to get into some of the social questions as well too, as we start to get close to the time here. But there's this. One question we have, and I think it's echoed in quite a few others, is that there's a lot of restrictions in place, right? The whole nature of delivering education is very different, whether it's students sitting further apart, limitations on interactions, wearing masks, things like that, hybrid schedules, whatever it is for wherever folks are in the country. It's safe to say it's a different world for learning. And how do we balance learning? What are we worried about the degradation of the learning that's occurring? As well as, what are some of the things teachers can do to help overcome some of these obstacles? Anna, I wonder if you have some thoughts to get us started on this. And Paula, I imagine there's some aspects in your world that are relevant here too. But Anne, do you want to get us started?
Sure. I think that's the core of the whole educational crisis. The issue is, how does the school stimulate learning to achieve the optimum outcome for each individual child? What resources are available to, in fact, focus on their needs and their differentiated learning style so that they can achieve their personal best? And then we go to resources. How does this occur? And I think it's fair to say that there has to be additional focus on what remote can do and achieve. It was imposed upon the city because there was no huddle, there was no review. We were all challenged to do something that never happened before. And that was an offshoot of a crisis that was not anticipated. And what came from that was lessons learned. What must occur now and is lacking clearly, and everyone here is certainly advocating appropriately to achieve the best, is this. There has to now be focus on what the K through 12 curriculum looks like, what the pedagogy is, what the support systems are, how they're going to translate learning in achievable ways, synchronous and asynchronous, with the teams of educators assigned to this moment. Because of budgetary crises, there has not been the partnering and identification of the appropriate teams of staff. This is a Herculean effort which has to be undertaken for all the reasons every one of you articulated. This is precious times in the lives of each child which can't be replicated. So what must now happen, since we have begun to identify the hurdle of safety? And yes, it's questionable, and we all have to decide whether or not it's satisfactory as described. But now, how to enrich the educational experience of children who've been isolated in a community, in a time of turmoil, in a time where their families are isolated, where they have not gotten the support. The reality of our world has shifted for many children. There's poverty, there's hunger, there's a lack of articulation with the system. And so what now must occur is, how do we enrich that learning? And that is what the teams will be working on. There are several teams dedicated to doing that, and they must communicate with you, meaning the parents, I'm a parent too, with regard to how best those needs are met. It is very hard to have such a succinct conversation when there's over 1 million kids, different zip codes, different communities, different family structures. So what we must do is drill down now to the deficiencies that have been identified in some of your remarks, identify how they can be responded to, deal with the socio-emotional growth and development of the children as we embrace an opportunity, because we do have an opportunity to allow learning to be achieved in a way that hasn't been before. and embrace their ability for mindfulness, embrace the children's ability for social justice, for tolerance, for respect. So all of that is on the agenda. In terms of articulating it, it will now be translated into different models that have to imitate successful plans. And they are not achieved in one shop stopping. And they have to be crafted and carved in a manner that makes sense in different communities so we can reflect what the needs are of those children. A children as a high achiever should be able to continue to ascend. A child who needs to be embraced in a lot of different ways should receive those resources. This is incredibly complicated. And to try to achieve a pathway to that means we have to use the talents, the ability, and the identifiable learning needs in our communities. But we can't do that alone. And we have to partner with whomever the guardians of children are. We have to partner in our communities. We have to rebuild trust. And we have to recognize that schools are the vehicle by which democratic societies prevail. So we have a lot at stake. We know that. We don't have clear solutions. But certainly what has been lacking is the outreach needed to engage incredible thinkers and people. And that has to happen now. Thank you.
Thank you. Thank you for your perspective as well, too, on that. And I think just really important in terms of the role and importance of education. And as you said, the stakes couldn't be higher. Dr. Madrid, I'm wondering if, from the broader lens, some additional thoughts you may have.
How can I really top what Anne just said? I mean, she really just covered pretty much everything that one can answer about these matters. I think that she's completely right about it all. What comes to mind to me as a psychologist, is not being an education expert, not knowing exactly what the many and daily and minute by minute challenges are that are being taking place right now. What comes to mind to me is that perhaps one of the ways to move forward, one of the ways in which we can, instill some resiliency and adaptability in our children and thereby help the community in many ways, is to also think about this as something that is temporary. I did hear loud and clear from the other panelists that this may be a reality that we live with in some way for the rest of our lives. I really do get that. At the same time, I cannot stop thinking that, there will be, better times will come. And this can perhaps be seen as a bit of a parenthesis. I realize that education should never stop. It is really, really important. There's much more than just learning. There's social learning. There's meals that are being served in schools. There's a lot that is happening. At the same time, we can also focus. There's ways to focus on social emotional learning, because that is a method by which the academic learning can actually be facilitated. Children who are healthy and ready and able to learn because they have some other basic needs met, I think we'll have better outcomes. And so I really encourage those, the powers that be to really also focus a great deal on that. How can we make sure the families have all of their other needs met or are working towards those so that better outcomes will take place, so that looking back at some point, perhaps next year around this time, the lessons learned actually are very good. Perhaps there were things that really made a difference. Keeping in mind the very specific needs of children, those who are more advanced, those who have some issues of perhaps behavior or development. But also just kind of taking a minute to say, well, it is challenging, it is tough. Most people are doing the very best they can. And so let's kind of sit with that for a minute and let's do the very best we can within our ability, right? So that if that means our children cannot socialize with their peers right now, well, maybe there's a subset of peers that they can actually socialize with. Maybe there's more online interaction, just finding ways around it and communicating to them that it is temporary. I think that will make a difference. Children don't always have a good sense of timing and perspective around how long things will last, but communicating that I think can be invaluable because it'll ease their anxiety. Those who want to go back to school will actually face many, many different challenges that they've never faced. They'll have anxieties, they'll have to follow rules that they may not, be prepared to follow. They may anticipate the ability to socialize in ways that they actually won't be able to. There may not be physical education. So there's a lot that may not be there that they believe might be the case. So even preparing them for, for the fact that it's an unknown at this moment, and that, at times that's okay. I mean, I don't want it to be okay. I really don't. But, saying there's a time for everything. And this is a time for learning. And we can say this, my 7-year-old has heard this pretty much a lot in the last few weeks, and we'll do our best. I think that those can be, profoundly good messages that can go a long way in the time in which everyone has anxiety and fear of the unknown. Also because we can't control much right now, but what we can control is the messaging at home. And that's kind of what I think is, from the psychology perspective, is what we can do.
Thank you so much. I know we're at time. If folks can hang out just like a couple minutes, that'd be great. I understand if you have to go, but I just want to land on a couple of sort of resources to help close us out and talk a little bit about, for the questions that aren't answered, some leads on to help find some information. But let me I'm looking at you first, Jay. There's a lot of questions in the box on New York City specifically. We obviously have a lot of folks tuning in from New York City, a lot of conversation that's been going on. Obviously, too much to get to in a couple of minutes, but where can folks go to get more information on this, as well as to engage in the conversation? Are there some town halls the Department of Education is doing, or something like that? How can folks find the right venue for really getting a lot deeper in some of the things brought up today?
Jeff, that's actually a great question. And unfortunately, I'll have to check with my DOE colleagues on that. I know that they're trying to host a number of sort of virtual town halls and events to address this. I don't know the exact schedule of them. So maybe after this, I'll send a message to people, try to get some information, and then send it back to you guys. And then hopefully you'll have the distribution list. You can send that out to people for.
Great, thank you. I know you need to jump off.
Yeah, thanks a lot.
Thank you so much. Thanks for joining us. And like I said, I really encourage folks here. I know we only scratched the surface on some of this, but really we'll get some information on how to do a deep dive with this. And I actually wanted to give a chance, Doris, if you don't mind me putting you on the spot one last time, as a parent of a student, as a daughter of an educator, what's kind of the one or a piece of advice you would give to other folks going through this in terms of what to look for, how to approach this, or just what's one thing you would want to tell some of the parents on the panel or watching from home right now on what to look for?
Just, to have patience through the whole situation, and definitely try to take care of your anxieties with this whole situation, because we are in a household where there are multi-generational people, and we've had to lean on each other to just calm our nerves and to actually go out and take walks when it was safe, in our neighborhood, because in Mount Vernon, where we are, it's not as many people as New York City. So we're able to at least walk around in the neighborhood and take walks and just breathe and try to just do what we feel is safe for us, as far as, taking care of yourself with your vitamins and mental health, if you have to do yoga or just breathe or just go in a place and just sit down and breathe. Take it easy. And then, we've been getting information from the television, which is the news, and taking out information that is important to us, which makes sense, and just disregard the stuff that doesn't make sense. And just be calm, and just take it day by day. That's all we can do. That's all we can do. We've done that. And, just keep listening to what's happening to the medical professionals, and just doing it based on what they're saying to you. Just take it as it comes, That's all I could say, is that, just as being in a family, you get to know each other better. Everybody's focused now because you're home, so you got to focus on things, and You know, we've done a whole lot of other things with writing in journals, reading books, anything to calm ourselves during this time, because it is very stressful. And not knowing what this virus can do. And we've learned over months that it affects people differently. And that's another thing that's nerve-wracking our brains. It's like with the asymptomatic person, we have no idea who is and who isn't. We don't even know if we are. So, you know, we're going today, me and my son are going to get tested today. And we've been inside since March. We have not been around people, you know, and we love to go to the city. And I had to explain to my son, right now, we cannot do it. So, you know, we're just going to keep learning about this virus and keeping ourselves safe mentally, and just take day by day. That's all we can do. That's all we can do.
Yeah, I think that's fabulous advice, and really, I mean, the only advice right now, right, is to take it day by day, take in what you can. Really, really appreciate it. A couple of things I want to let folks know. There have been some questions. Yes, the recording of this will be available, so it'll be through the Earth Institute and their YouTube page, and we'll help push it out as well too. We are going to take a look at ways of either getting, as Jay mentioned, but as well as a lot of these other questions on here, of finding ways to either get those answered or point to resources. I do also want to very quickly point out at our center, the National Center for Disaster Preparedness, we have a series of resources, some that we've developed, some that we point to that are out there that are really good, focused on COVID-19. As part of our Resilient Children, Resilient Communities initiative, there's a couple of other tools. We have a guide we developed with the Children's Health Fund for clinicians for how to talk to kids about COVID-19 with different age levels and different language styles of those ages. And I think that that's actually valuable even for the non-clinician, but just, you know, we'll continue to curate resources as we can and help point folks to the best available science as it becomes available regarding this pandemic. I'm going to give Erwin the last word, but before I hand off, I just want to say thank you to all of you on the panel today for giving us your time, your expertise. There's so much more I wanted to ask and so much more time, certainly deserving, but actually a colleague of mine used to always say, you know, the most precious thing people have to give is their time, and you've given us a lot, and very, very grateful for all that you do now and into the future, as well as everyone for tuning in today and joining in the conversation. With that, Erwin, I'll hand it back to you for the last word, and yeah, just thank you, everyone.
Yes, also I just want to add my thanks, and really, Jeff, great job moderating this very complicated issue and a very important one. The panelists were they exceeded expectations, and it was just a fantastic conversation. I'm sorry we couldn't get to all the questions, but as Jeff pointed out, we will have a mechanism for figuring out how to respond to people whose questions were unanswered. Anyway, thank you. Have a great day, and more to come. Very, very appreciate those of you who joined to listen in, and again, to the panelists. Thanks, everybody, and have a great day.